Good morning once again, Congressman Joe Kennedy. Welcome to the special edition on TelebelTop. How are you this morning?
I'm wonderful, thank you. Thanks for having me back.
Thank you for coming once again. In the last 5 weeks, more than 30 million Americans have filed for unemployment. Many Americans are worried about losing their health care in this crucial time. And what needs to be done to accommodate health care for the American people during this pandemic?
One of the great inequities that we are seeing that this crisis is exposing is what happens when people do not have access to healthcare. And that's not just insurance coverage. That means access to a doctor, access to medicine, access to treatment. And so we need to 100% ensure that every single person in this country gets access to the treatment that they need when they need it. And look, that's the underlying promise of Medicare for All, and why I'm a big supporter of the bill. But in the meantime, as we face resistance from Republicans in order to make that a reality, we need to pass a bill like the one that I filed with Pramila Jayapal, a colleague from Washington State, called the Medicare Crisis Program Act, which ensures that if you lost your job, you get enrolled in Medicare. It creates a drastic expansion of Medicaid, and it ensures that with regards to the coronavirus, that all costs associated not just with testing, but with treatment are going to be covered without any cost sharing, meaning that if you get sick, you can have confidence to call a doctor, to go get tested, to get the treatment that you need to get healthy, and not have to worry about going bankrupt. And this is critically important. Not just is it the right thing to do, because people deserve access to healthcare in a pandemic, but what this crisis has also exposed is that your health is linked to mine, and that we will not get through this crisis as long as a virus continues to spread within parts of our community. Bills like this, the Medicare Crisis Program Act, are ways that we are going to ensure that we actually eradicate the spread of this virus.
Okay, but President Trump urged the Supreme Court to overturn Obamacare's. What's your response to that?
The president, the list of proposals that the president has put forth that makes our country weaker and less able to address this pandemic is long, and unfortunately not ending anytime soon. The inconsistencies with which he has led this country over the course of the past, over the course of his tenure, but certainly over the course of the past several months, has had a devastating impact on our ability to get in front of this virus. And clearly, the idea that we should overturn a program that has provided a healthcare lifeline to literally millions of Americans is probably the worst thing you could do in the midst of a novel virus and a deadly global pandemic.
As the coronavirus pandemic has shut down borders and airports across the world, immigration and custom enforcement ICE continue to fly every 2 or 3 days, 3 weeks, a deportation flight. In early April, at least 3 of those deported tested positive in Haiti for COVID-19. Why they did not provide healthcare, medical care to those people? Is it appropriate to deport people right now in this time?
No. Look, the idea that at the very least, if we're going to go forward with extractions from this country, with deportations, we should be ensuring that the people that are being deported are tested, and that they're not infected with the virus. The idea that the United States would be deporting people that are infected with a deadly global pandemic and deporting them to other nations that have, on the whole, less ability to deal with them, we are literally exporting a part of a disease. It's unconscionable. And so, no, what we should do is ensure, one, that if somebody is sick here, that they get access to the medical treatment that they need to get well. We need to take the appropriate mitigating steps to ensure that we do not spread a virus within our detention facilities, within our jails, which has been a big issue around the country and flared up here in Massachusetts last week with an altercation in a facility in Bristol County, in county that encompasses much of my district, and a facility just outside. But the idea that we as a government, federal, state, local, wherever it is in the United States, is not doing all that we can to protect the health and safety of everyone in the system. So whether that's the guards and the personnel keeping everybody safe in those facilities, or detainees or inmates, and that we might actually be deporting some of those individuals that are infected, and that we did so knowingly, is unconscionable and absolutely needs to stop.
Okay, a lot of frontline workers are immigrants, especially in the health care industry. Healthcare workers are complaining about PPE, I'm sorry. Some of them are afraid to talk about it because of their immigration status. How can you advocate for these healthcare people as a congressman?
A lot of ways. And look, if there is another lesson out of this crisis, it is the extraordinary work that our essential workers are providing to our society so that the rest of us are able to function. And obviously, that begins with our doctors and our nurses and our first responders, our EMTs. But that extends to the folks stocking shelves at a grocery store or the little bodega down the street. That's the folks delivering our mail and our packages. That is the folks that we rely on so that the rest of our community can actually get by and get through this extremely difficult time. And those home health aides, those folks providing essential services in our senior centers and our nursing homes, as you say, a large number of those individuals are in fact immigrants. And so what we need to do is recognize the extraordinary work that these essential workers are providing and actually treat them as essential. No longer try to just exploit or take for granted the work that they do, but actually recognize the contribution that they make, pay them a living wage so that they can live with dignity, ensure that they have the benefits that they are providing to everyone else, that it comes back to them, that they can retire with some security, that they are able to actually not fall victim to this movement of independent contractors and a reclassification of workers, make sure that they actually get healthcare benefits that they are providing to others. And it's that type of acknowledgement and treatment that we need to build out of this crisis to ensure that we do not fall into another one again. And 100%, when we look at the communities that have been most affected by this virus, while it is true it can infect anyone, the communities that have borne the brunt of those infection rates and a disproportionate share of those that end up being sick, it's largely immigrant communities. It's Chelsea, it's Brockton, it's Lawrence, it's Revere. And that's not surprising. There are structural inequities that are responsible for that, and we need to be intentional and direct about the way in which we're going to respond.
Okay, people see the U.S. as a champion of democracy, and the president denied access to Dr. Fauci to testify in front of the House of Congress, but he accepted to go in front of the Senate. What kind of signal we are sending to the world if we are the champion of democracy in our own territory, we don't follow the protocol of democracy?
Getting back a bit to what we talked about a moment ago, this administration, the decision of this administration to not make their witnesses or their members, the folks that are responding to this crisis, available to questions from elected officials, shows that they are insecure and uncertain as to the quality of their response. If you had confidence in the way in which you were responding to a global pandemic, you would put yourself forward and answer those questions and welcome that chance to engage with elected officials, with the media. You look at the way that Governor Cuomo is responding in New York, the way that Governor Baker has responded in Massachusetts, the way in which Governor Newsom has responded in California, where they get in front of the press, they answer whatever questions they possibly can. And there might be disagreements, but they are clear. They're clear about what we know, what we don't, and the measures that they're taking. That is exactly the opposite of what this administration is doing. And their decision to try to say that we will provide witnesses to one House of Congress that is Republican controlled, but not provide witnesses to a Democratic controlled House is not only damaging to our democracy, but points to the insecurity and concern that the administration has with regards to the quality of their response, and shows that they know that it has not been as strong as it needs to be.
Okay, we have a public health crisis right now around the world. And the US, a lot of people die from the coronavirus. The president been promoting the reopening of the country. But this morning, the media reported the president rejected the CDC guideline. What does that mean for the American people?
The president has, at multiple times over the course of this pandemic and before, rejected, ignored, and taken opposite measures from the scientists, doctors, and medical professionals that were urging the president to take, and his administration to take the prospect of this virus far more seriously. And that begins years ago from the president's dismantling of structures and firing of officials that were actually in his administration to actually were built to focus on response to a pandemic. The Department of Health and Human Services, about a year and a half ago, ran a simulation about a flu-like virus that started from an animal market in China and spread through global air travel. They ran a simulation essentially on this scenario. They had a report and the administration ignored it. They have chosen on multiple occasions to disregard facts that they find to be inconvenient or troubling and solely focus on what the narrative that they hope would be true or would come to pass. And we, as society here, are living with the consequences of it. Look, you look at where we have come with regards to a scope of an increase in testing over the course of the past month as a nation. We've made dramatic strides. But think of where we would be today if we had that capability a month ago. In a global pandemic, days matter, weeks matter, months are extraordinarily important. And the fact that this administration delayed its robust and aggressive response for months has led to the part of the devastation that we have seen for our economy. It's led to the dislocation, and it's led to the deaths of tens of thousands of people.
The month of May is recognized as the Haitian Heritage Month in Massachusetts.
Yep.
What do you want to say to the Haitian people? Because this year we're not going to have the parade on Louis Laf.
I know. So one, I'm so sorry that we're not going to have the opportunity to engage in person on some of these celebrations over the course of the month. I hope by the end of the month we'll be in a better place to do so. But one, an extraordinary celebration of the contribution that a Haitian community makes to the United States, and going back an awful long way, and particularly here in a Boston community, and an appreciation and recognition for all that a Haitian community does for Massachusetts. But second, getting back to what you said about the jobs that are held by largely immigrant workers and immigrants to this country. The fact that anyone and Haitian families have chosen to come here is the greatest compliment somebody can pay to the United States. The fact that once here, the jobs that a large percentage of the Haitian community engage in, healthcare, home health aides, health services, providing essential and dignified services to people in need is an extraordinary testament to the character of the Haitian people. And I am so grateful for all that you have done for our community here in Greater Boston and what you've done for our Commonwealth, and look forward to supporting your efforts any way I can in the months and years ahead.
I know you speak Spanish very well. Do you know any Haitian Creole word?
I'm parle Creole, and that's about it.
Okay. Thank you very much. Congressman. Have a good day.
Thank you.
Thank you very much.